My name is Robert Lerrigo. I am a gastroenterologist, just graduated fellowship from Stanford, and I have a special interest in inflammatory bowel disease.
My name is Amber Tresca, and I am the IBD expert at verywell.com, which I've been doing for a really, really long time, around about the time that I had colectomy surgery and J-pouch creation in 1999 due to ulcerative colitis. And my question is, can one have both ulcerative colitis and Crohn's disease at the same time?
Yeah, that's also another great question, Amber, and I think it really digs into the whole frustration patients can deal with when they've been living for a while with one form of IBD and then their doc tells them, oh, we think we could be this other form, or we're not really sure. Or they start off with the diagnosis of, I'm not really sure what form of IBD, but I think it's IBD. Typically, I don't typically think of patients, a patient population having both ulcerative colitis and Crohn's disease. From a histologic perspective, they're very different entities, meaning if I were to take if I were to take part of your colon out and look under the microscope, they would look pretty different. However, having said that, usually when ulcerative colitis or Crohn's disease presents very early on, it can manifest in very subtle ways, and it's usually more difficult to differentiate between ulcerative colitis and Crohn's disease in the early stages. The distribution sometimes can be a little bit similar. Thankfully, the treatments for both can be similar, but just like a lot of diseases out there, frustratingly for patients and for providers, sometimes the disease needs to be a little bit more advanced before we can really say, aha, it's UC, or aha, it's Crohn's disease. And it's true that sometimes, we're really confident patients have ulcerative colitis, and then they get their, colon removed, and all of a sudden they develop disease in their ileum, and that leaves us thinking, well, maybe now it's Crohn's disease. We don't really know. Is it transforming from ulcerative colitis to Crohn's disease, or was it Crohn's disease all along? That's really not really known. But yeah, it's a very common frustration I see among patients who've had IBD for quite a while.
Following with the idea that it's a spectrum disease, but I think where people get hung up a lot of times is in the way things are named. For instance, Crohn's colitis. Can you just quickly describe what that is so that people can understand that that doesn't mean both diseases at the same time?
Right, exactly. So colitis just means inflammation of the colon. And people need to realize that that's a really non-specific term. What I mean by that is there are a lot of things that can cause inflammation of the colon. So doctors may give diagnosis of colitis, and people may automatically think, oh, do I have IBD? And they think that they have IBD, and that can happen for years. Colitis, inflammation of the colon, can be caused by a lot of different things. Lack of blood flow to part of the colon. It can be caused by infection. It can be caused by some kind of autoimmune factor, and IBD would fall within that. Now, Crohn's disease implies a very specific form of colitis, and it falls under the branch of inflammatory bowel disease, which has multiple flavors, but we tend to think mainly Crohn's disease and ulcerative colitis. Now, Crohn's disease, by its nature, tends to have a very patchy distribution in the colon. It can also affect the small intestines, and really, but less rarely, but more rarely, it can affect other parts of the GI tract as well. So if you have Crohn's that affects the small intestines, particularly the small intestine called the ileus, we say that patients have Crohn's ileitis, which is different from Crohn's colitis, which is the large intestine. So it's a lot of medical jargon. It can get a little bit confusing. I really encourage people to really ask questions if they are confused about terminology. These terms have a lot of meaning, and so when patients are bringing their medical records from one provider to another, it's really important that we get the right terms in our head.